Hi everyone, how are you guys doing? Just give me a second, I'll have other people. Hi Pavitra, I can see you there. Let's give a few minutes to other students, to everyone to join in, and then I'll start with the introduction. Okay. I see that some of you have already requested to join the live, so just give me a few minutes and I'll start. Anyways, I'm Ankit, one of the instructor for OCE clinical classes, and this live is for students kind of like appreciating hard work of the students who passed their OCE exam recently. Like they got their results yesterday, and I mean everyone deserves appreciation for all the hard work that they have done. So this live is for those students who passed the clinical exam. As you know, it's such a long journey. Like you start with the credential evaluation, then you take the written component, you study so hard for many months, then you take the clinical component, and then you become licensed. So tonight's live is mainly for those students who have completed all those steps and are registered physiotherapist in Canada. Okay. So such a long journey, they deserve applause. Second thing is, a lot of students reach out to us regarding queries like how hard is Ontario clinical exam? Will we be able to make it? So this live is to hear from those students directly, those registered therapists directly. How should anyone who's preparing for this exam, who's going for exam in October or January or next year in March, how should they prepare for this exam? Okay. Now, many of you are attending this live from other parts like British Columbia or Alberta. So one thing for British Columbia students is, as you know, that after passing the written component, you're not allowed to practice now. So one strategy could be, go ahead and take the exam in Ontario, OCE clinical. You don't have to be in Ontario. Even if you're in British Columbia, take the exam for Ontario, and later on you can always transfer it. Okay, that's one option, but make sure you confirm with your board, with your provincial board. But that is one strategy. So that's why Ontario is becoming more popular. Other reason is Ontario is still conducting online exam, and British Columbia, Alberta, they have moved to in-person. So it's always a good idea to take online practical exam compared to in-person clinical exam. Okay. All right. So let me have some of these students. I see many of them have requested for the live. So let me have Lavina. Let me try to get Pavitra. Okay, I believe. Are you Lavina? Is that you,
Hello,
Lavina?
sir. Yes, sir.
Hi, Lavina. How are you?
I'm good. How are you, sir?
Good. And that's Pavitra, right, Pavitra?
Yeah.
Just let me adjust this. Instagram always gives me some trouble. Okay. So first of all, congratulations to both of you. I mean, it's a big achievement. Like I was talking about all those steps, starting from credentialing, to written, to now being fully registered therapist.
It's a long journey.
Yeah, it is a long journey. So again, congratulations. But we want to hear from you guys, like anybody who's preparing for the exam, like students who are going for exam in October. I think that's the nearest exam. What should be their strategy? As you know, you have part A and part B. Part A, those of you who don't know, it's more of like muscular neurocardio section or other system, and part B is ethics. So I want to hear from you, Lavina. Like, what should be the strategy for part A? Like, should we read all those muscular neurocardio completely in detail?
No, I don't think so. We have to read everything. Just we have to be knowledge, like what is the CTS, what is supraspinatus tendinitis, such like a condition you have an idea. Just like what is this condition. Otherwise everything is mentioned in the question, and you have to read through the question. You have to be fast in reading the question because questions are so long.
Okay.
So
questions are long, and I mean they have all the information, but they do ask you questions.
Yeah.
Are those questions, how will you rate the difficulty level of those questions, like from 1 to 10? How hard are those questions from the examiners for part A?
I think if you understand, if you read whole question in just 5 minutes what they gave, because one question was around 3 or 4 page. So if you read that question in 5 minutes and you understand everything, so the difficulty level, I think it was around 3 and 4, not more
not
than
more
that.
than that?
No.
Okay, maybe you guys are study buddy students, that's why it was like
Yeah.
that.
Yeah, this is true.
That's great. So Pavitra, what do you think about those questions? Did you struggle when the examiners were asking those questions in part A? How
Actually,
hard?
it's straightforward. They're not asking questions that's too tricky. They'll be like, what's your rationale behind it? So it's more generic, like they're asking for assessment in general. But whatever answer you say, they'll be asking like, what's the rationale behind it? Like, why are you saying that? Why are you doing this? So it's more direct. And they are giving a lot of hints, like questions, the follow-up, and they want the answer. So they try to ask questions, so we answer what they are expecting. And like you asked, part 1, we don't need to study everything, but common conditions we see in our practice, like clinically or in rehab, it's more common conditions. So that would be helpful if we see the common ones rather than studying every conditions at once.
Okay.
Yeah.
Okay. That's great. That's great. Now, so you have done the written component. You guys have done it with us. Now, the clinical part, let's say part A, how different was it? What was different in part A compared to what you guys have already studied in the written component, for the written component? So I can go with you, Lavina. What do you think?
I think like after attending your class, everything seems easy for me, especially MSK. And yeah, they are considered more on MSK. So it was more easy in the clinical. I don't think any facing any difficulty. I think it's so easy exam right now. I feel that because you made our base very strong. So MSK is like candy for us.
I hope Ontario is not listening. Like, it's such an easy exam. Hope they don't make it difficult. But that's good to know, at least for part A. Now, how about you, Pavitra? Like, compared to written, for the clinical exam, how difficult was part A, like studying for part A? Like, was there anything new that you prepared for it, or it was more of a revision of written?
Nothing new, but verbalizing, like remembering, because practice is different with written, right?
Yes.
We see keywords, we try that, but verbalizing for part 1 and like answering what they're asking for, it's different. And it's more like practical based, right? Yeah.
That's a good strategy, everyone. So what she has shared is for the written component. What you do is, like, if a question comes PFPS and you have time to eliminate options, A, B, C is wrong, Y, D is right, and you don't have to explain anybody.
Yeah.
You just select the option, you move on. So, but here, now you have to explain me why are you strengthening or why are you stretching PFPS or IT band, or why not are you using wedge right now, or why are you using wedge right now? Why not are you strengthening GMAT? That explanation, like, so practice of those kind of like verbalizing the explanation.
And you have to be fast, like and within 2 minutes you have to think the answer what you have to say, because they are not like listening to you whatever you will say. They just want your answer whatever they ask, like particular the things.
And like if they are not getting the answer, let's say they're asking something, and let's say, for example, if I ask you PFPS and you're explaining me about the wedge for treatment purpose, but they're expecting about the muscle, how do they help you guys there that way? Like, do they ask you something, like, do they give you any hint?
Actually, they asked a question again. They they paraphrase the question and they'll be like, we are asking this. And enough information, they'll be like, we got enough information. They'll stop you there. Actually, they don't let you explain more if they got the information. But if they're asking more probing, which means they need something else,
they're still looking for their answer.
Like, we can, like, can you repeat it? And then we'll be like, can I take a minute so I can take some points, they are okay with that. They are not pushing, or they are not like you should take your time. They are very, like,
They are very familiar.
Yeah.
They are very helpful.
That's good. So now coming to part B. Part B is ethics, and as you know, ethics has like 11 categories. So if I ask you guys, in those 11 categories, I mean, we have done that in the written component also, quite a lot. Now, this clinical component, a lot of things were new. Like, for example, time management or prioritization, or some kind of some infection. I mean, infection precaution, we do that in the written part also. But what was difficult in part B, the ethics section? Like during your preparation, what category did you find most difficult?
For me, I think prioritization, because the points they give, they are very like nearby. So it is hard to prioritize what you have to prioritize, this patient first or this patient first. But they want the specific answer. If you explain everything, like you will tackle this also, this patient also, or you will take care of that patient also, how you will take care everything, but what you will prioritize first, like this patient or that patient, they want particular one. So it seems a little bit difficult for me.
So and now in part B, like in those 11 categories, like from all those categories, were they probing too much? Were they like making it more difficult compared to part A, or was it still straightforward?
I feel that both are similar. Like in the part 2 ethics, they were also probing what they want answer, and particularly whatever they want, they are asking that thing.
Okay.
Yeah.
So
okay. How about you?
More in part 2, because they need the rational, right? Like then they are like specific to this case. Like we'll give options. They'll be like, stick to the case and say what you will exactly do in here. Like and they are asking. They ask a lot of probing with part A. If they got the answer, they won't be.
Okay.
There are where I told everything. They are like, okay, I got the information, but there are questions they are like constantly asking, probing, and they'll make us answer somehow.
yeah.
So they are
Because
what else? The
part
word
A.
what else pushes your mind. What else we have to think?
Yeah. I think some of the students told me that when they keep asking so many what more, one of the student did was she like, can I have a minute? And she went back and reread the whole case, and then she was able to catch, okay, I missed this part, let me explain this. And as soon as she answered that part, they're like, okay, let's move on. They did not say it's right or wrong, but that was a hint that she got it.
Correct.
So anybody listening, I mean, they will wait to hear the best answer from you. Once they get it, they'll move on. So don't think that it's rude.
That could be a small, like it's a simple point to like documentation. We might have missed it in like in pressure, but
Correct.
that point they're looking for.
Correct.
Yeah. That's good. That's good to know. So any last feedback, any last unique tip? So from you, Lavina, any last one unique tip for students who are preparing for the exam? Now, did you guys take any mentorship from us?
Yes.
Both of you had a mentor?
Yeah.
And who was your mentor, Lavina?
Mine was
Mehul, sir.
Mehul? And for you, Pavitra? Vrunda. Okay. How was this? Now, did you guys take mentorship in the written component?
Yes.
Yes? You did not? Okay. So how helpful is mentorship for the clinical? So I'll go with you, Lavina. What do you think? Like
my tip
is
that thing, like you have to take the mentorship, because mentorship is really very helpful. They just prepare you what you have to say, and you have someone like an examiner who listen to you, who give you feedback, and you can improve on that point. So this is the must thing I will say to pass the exam. Yeah.
How about you, Pavitra? What do you think?
Yeah, I feel the same. Mentorship really helps, because someone is like looking at you, correcting you, and also Vrinda was very helpful to me. Like she knows what's my strength and weakness. She'll be like, okay, focus on this and study this. We keep discussing it more. So even though we have steady partners, someone who has the knowledge on it and
like an example.
Work,
Because I think after listening to your feedback, what I think is like let's say you're answering to somebody. Let's say if I ask you a question and you're answering me and you're explaining your point, that's basically a practice.
Yeah.
Which, rather than just practicing in front of the examiner that day, practicing in front of your mentors, eventually, if you have to explain the same thing, like for example, ethics has same categories. So if you have to explain same thing to the examiner that day, definitely at least your fluency will be better. You'll be more confident compared to a first timer explaining the examiner. So I think that's a good strategy. Plus over here you get feedback also, like how you're talking and those kind of things, which is that's a great feedback. Any last unique tip to share with students?
So what I did was, with my study partner, we usually take cases from our practice. Like whatever we are seeing, we take cases from us and we prepare a case and we discuss it over. So because they are asking common conditions, right? Like musculoskeletal or anything. So that was helpful for me because we discussed all the common ones.
So you said cases from your clinic and then you discuss that?
Yeah.
Okay, that's a great strategy. How about you, Lavina?
Because we worked different sites before. Okay. So we know like what cases we commonly see in each practice. So that was helpful for me. Yeah.
That's a great feedback. How about you, Lavina? Anything unique?
I think just verbalize how much as you can, so you will be more confident in front of the examiner, and try to be prepared in the pressure, like with the time. You have to prepare with the time. So in the exam, you will not be nervous, like my time is going and I have to cover everything.
Okay. Those are some great strategies. For the practicals are always scary because it's one-on-one. You don't have time to eliminate options. You have to right away answer somebody, and that person is judging you. And one mistake, and things can may not fall in place. So it's a great strategy. So again, congratulations to both of you.
Thank you.
I mean, go out, work. I mean, definitely you guys were already working, but more than work, it's more of an achievement. Okay, this is something that you'll be proud for the rest of your life. I always tell everyone that what is my biggest achievement? I don't say it's study buddy, but I'd say it's like the license exam, after passing the license exam. So again, this will be a moment that you guys will always cherish for the rest of your life, and you should be, because it's a big achievement, one of the toughest exams in the world, and you guys did crack both of them, written and common. So be proud of yourself. Go out and enjoy.
I just want to say one thing. In the exam, just read the examiner face, because if you go somewhere wrong, they will just give you some expression like that, like you are wrong. And if you don't understand what they want to ask, you can again ask them, like, can you paraphrase the question, or what like they want to listen.
Did you have Indian examiners? Because they have all the expressions.
I have one Indian and one foreigner.
Yeah, mine was not. So I couldn't read their face actually.
Because I think I don't think Caucasians have much expression. But I guess Indians will have. But that's a good strategy. So guys, read their face. Okay, look at their face. Don't just like look here and there. Look at their face. Try to understand what exactly are they trying to hint. And that's a sign of confidence. If you can look in somebody's eyes, that's a sign of confidence. Again, thank you again to both of you. Go out and celebrate, and I'll try to have other students. So let me have.
Thank you.
Let me see if I can get Shri and Priya. Let me get Priya. And once you guys log out, I'll be able to get the other students in. And guys, if you're listening, just share. You can ask questions. I believe some of you asked that, were they working full time? I'm pretty sure. Is that Priya?
Yes, sir.
Hi, Shri.
Hi, Ankit.
Shri is one of the most skilled. So I'll start introduction of Shri. Just give me a second. Let me see. I was looking at one of the questions.
Sure.
So Rach D'Souza was asking, were you guys working throughout while preparing for the exam? I think, Rach, that's the normal strategy for most students. Everybody is working full time, and then maybe at the end of the day, they're studying, either reading from notes, an hour, which is sufficient to pass the exam. Okay, all right, cool. So we have Shri here. She is one of our mentors for the written NPTE exam, and she is licensed both in US and Canada. So itself is a big achievement. And she passed her this clinical exam also now, so for Ontario, which is a big achievement. Another thing is, a lot of her students passed NPTE yesterday, like with extremely high scores. So we are very proud of you for all those things that you do.
Thank you.
And so we are proud of you for this. Now, are you wearing a t-shirt of Study Buddy?
Yes.
that's good to see. Okay, cool. So Priya, congratulations to you too. This is a big victory.
Yes, sir.
Priya, when did you pass your written exam?
In November.
In November
2022.
And this was in July, clinical, right?
Yes.
So that's awesome. So Priya, I will start with you.
Yep.
what do you want to say about part B? Like, which section was hard during the preparation, part A or part B for you?
For me is ethics because in part one, my test like started like 30 minutes late. So they were like really fast with me, but they are giving me a time.
Mhm.
So in part two, the question they are asking, I was like, I have to go read again because I was exhausted because I was sitting like 30
Okay.
minutes and
Yeah,
doing
yeah, yeah.
nothing. But they gave me enough time, and I also finished my exam like 30 minutes early. It's very good.
Wow. I mean, you have to be ultra good
Yeah.
for that. Yeah, which is very good. So was part B
So,
more challenging?
for me, it's challenging because you have to like think. But if
Okay,
you like stuck somewhere, they will like ask you, like paraphrase the question, and they'll ask you again.
okay. So they were helping, giving a hint.
Hint, yes.
Okay, okay. Um, so the audience who's listening right now, what should be their strategy to be good in part B at least, like ethics section, those 11 categories? How should they prepare?
I would say your classes are good, like you are interacting in a way that, and they also go read on the website because they update a lot of things, and
Mhm,
which were helping me a lot.
mhm.
And when you ask, because they were not asking me like back to back question, they just asked me in the ethics like only one question, and they move ahead.
Like move to the next category or follow up on the same thing?
Next, no, like next category. They just asked me like one question for one like scenario.
That's how you finish the exam so fast. I guess
Yeah.
maybe they liked you, they did not fail you
Because
because, or maybe you were answering what they were expecting in the very first
expecting,
question,
yeah,
so they don't have to like keep asking you again and again.
asking
Hey,
again and
give me that
again.
answer.
Yeah.
Okay, so that's a good strategy. How about you, Shri? What do you think about part B? What should a student do?
I think Ankit, like she said, reading the website is important because they have a lot of information. The classes are definitely good that we have in Study Buddy to practice cases,
Mm-hmm.
but along with that, they update constantly on the website. And I don't even know if I went through the whole website. Like sub categories are there, and there are some cases too,
Mm-hmm.
randomly that you can see as they update. And there is case of the month, and recent cases of the month also helps, like how they what kind of case they got and how they gave a judgment call on that and what was the repercussion for that. So
Mm-hmm.
that way we know if something similar comes up in the exam. So it's important to go through the college website.
Now, how different, Shri, was this like compared to written ethics and the written component versus clinical component? The content wise, not the like it's the delivery part is definitely different, but content wise, how different was it?
Content wise, I think they addressed, I would say, like they have a pattern, right? They have to touch base with all the 11 ethical scenarios. They can't give you same ethical problem in every question. Whereas in written, it is not necessary that they'll cover up all the scenarios. It's not the pattern, right?
Mhm.
They can repeat a ethics problem or things like that. They can maybe cover only like 4 ethics topics. So I would say in clinical component,
Mhm.
knowing ethics is play a major role than in the written component. Yes, written has a major role in ethics, I won't deny that.
Mhm.
But if you ask me which one between the written and the clinical, I would say clinical ethical part plays a major role in you
Passing.
passing the exam. Yeah,
Okay.
because of the fact that, again, like previously they said that you have to be organized in your thought process. You cannot stutter. Like in the written component, you can go back and forth and you can,
We'll change
do
that.
what you want to do. You can change your answer. You cannot say, I'm sorry when
Yeah.
you're doing written component. That's the
Yeah.
problem. That's the major, I think, setback
Plus,
between written and
like
clinical.
in part A, like muscular and all, I mean, to treat impingement, like there's one answer, and you and the examiner are on the same page. Here, how to talk to a patient, everyone can have 10 different ways. Now, which way are they looking at? So that's where things get a little tricky. Like, what are they expecting? Now, Shay, with you, did you struggle to answer any of the question where they kept asking too many follow-up questions? They were expecting an answer, and you're like, what are they expecting?
I think if I still remember, I think I shared this with you
Not
already
not
about
not the
part
case,
A.
but the category. If you can just share the category. Was it part A? You said.
It was in part A. Ethics, I think, spot on. I think because of ethics, I passed the exam. I personally think, I don't know if that's true. But for part A, what happened was she asked me a question. Like I was answering pretty good for the probing questions. And at one point, she kind of asked me a question. I don't remember the question, but I did not understand the question. I really didn't understand what she was trying to ask me.
Okay.
So I kind of asked her, do you mind reframing the question? And she exactly repeated word to word the same thing she asked me. Personally, honestly, inside my mind, I was thinking, I heard you. I need a reframing of the question, but I just said what I felt like saying, and I'm not satisfied with what I said. That is one thing that scared me, that I did not probably make her satisfied. She moved on too after that. After I said that, she moved on. It could be that I got the answer right without understanding the question, or I got it so wrong that she thought there is no need to ask probing questions.
Let's move on. So that's so. I mean, those are some scary moments. I can imagine. Like if you're like in the clinical exam and they're asking something, you don't understand the question, forget answering the question, plus not any help from the examiner. So that can be a scary moment. But I guess again, if you can perform very good in other part B, that can, I think, cover up. So how about you, Priya? Any sticky point during your exam, like where you're like, what do I do now? Like, did you feel scared at any point?
It just felt like scary in the starting because you were just like happening first time online. So when they asked me like, will you accept this patient? Like they asked me twice and I gave the same answer. And that's what Sri is saying. That's what happened with me. I just remember I gave like same answer and they just move on.
Okay.
So I don't know whether they got my answer or no.
That's good to know. At least, so guys who are listening, if they're asking you again, maybe add 1 or 2 extra points to at least make them feel that, okay, you're trying, because there could be 100 answers for any question. And it's very hard. Like this exam is so unpredictable. Like how do we know which out of 100 are they expecting? So that's where things get a little tricky. But how should a student think? Like, should they think about safety part first when they're answering? Or how should a student think in that case? I mean, now after coming back.
So I was thinking like why we accept this patient from the scenario, and that's what I've explaining to them. Like they need the physio, they have this condition, like they are looking for the physio. So that's what I add like when they ask me second time, and they move on afterwards.
Okay.
And for the then they are like going fast with me. Like they said, oh, okay, just move on, getting all the points right.
So you had
I believe so.
Exam, right, Priya?
Yeah. Yeah, I had 2 examiners.
And were they both Caucasians or African American or Asians? What were they?
They were Caucasian, I believe so. They were not Indian. Yeah.
How helpful were they, your examiners? I mean, I know you don't want to have to criticize, but were you getting a lot of like friendly hints from them, or were they like, no, let's move on, let's like no smile, no expression on face?
From examiner 1, she's like very helpful in my part 1, but in part 2, when I ask her, oh, can you please repeat or rephrase, she just like say me like the same sentence, and maybe she just move on.
That was a difficult question for her also, like, how do I rephrase this? So I guess that may happen with examiner, but that's good to hear. So one last unique tip, Shri, what will you give to students who are going for exam in October? What is that one golden tip during your preparation?
I think if, because everybody passed their written component, I believe that everybody is very strong in their concepts and everybody is working in Canada. So they know what they're talking. It's not like they're going in without knowing nothing. The only thing is, from what I've learned, is be confident, don't stutter, don't change your answers, same concept. Like when you talk something, like for me, they try to probe you. Do you think it's right? Something like that, when we go a little offbeat, and then we have to be confident. I think that helped. You have to be confident in your answers, and you have to have a rationale for what you say. Like you said, there are several answers. As long as you can give a rationale or justification for why you answered what you answered, I think they will be pretty pretty happy with that, and they'll move on.
That's good.
One thing that helped me was I made points in whichever time they gave me, like 30 seconds or 1 minute in the ethics questions. I kind of made pointers, even one word pointers, like four, five words. That way I know what I'm talking. I'm not like thinking through where I'm talking. So I just look at the point and I talk about it 2 lines, and then look at the second point, talk about it 2 lines. That way I was not going back and forth, and I was not stuttering.
That's a good
that
strategy, because sometimes, you know what, in a flow, we might flow away from the important pointers that we noted. Like we end up explaining the first point or second point too much, and we missed third point. So guys, it might be an important strategy to note down just the word, what you have to explain, so that you don't end up missing something, and then examiner is continuously asking you what more, and then you're like completely lost it. So that's a good strategy. How about you, Priya? Something for students going for exam in October?
So I would suggest read the case once, but give more focus like to each word, so you don't have to go like back and forth, and then you can give your answer correctly.
Okay. Now, did you guys have a mentor? Do you guys take mentor for this part?
Yes.
Who was your
Yeah, Radhika.
Radhika. Okay, that's good. So anything? How was it, mentorship?
So her mentorship was like, she's my study partner because I don't have any study partner because of time conflicting. So she gave like every like 1 hour, 1.5 hour, and she discussed everything with you, and she gave like a feedback at the end.
That
So
was
which were
one-on-one?
very, one-on-one, yes.
Okay,
Which were very
okay.
helpful from her side, yeah.
I think mentorship does, and Sri, you did not have a, Sri is a mentor, so Sri doesn't need a mentor.
It's
So
not
I
that
think,
way, Ankit. I have a big batch of students, so I didn't have time to have a mentor. I'm not fortunate that way.
but that's a good strategy. I think when you perform in front of your mentor, like when you answer something in front of your mentor, that does make a big difference. Like, okay, and you also realize, what am I saying? Am I saying it correctly? Or because first time when you're just randomly saying something, you may make mistake. But if you keep practicing something again and again in front of somebody, I guess eventually you develop the fluency to answer correct things.
Yeah.
So those small things makes a difference. So Yashli, what were you adding? Were you saying something?
But I have to do special mention to Vrunda. I did a mock exam with her. I think that's like a no-brainer and reality check for me. That has changed the results, I think. Because till then I was clueless. I was not studying anything. I was not doing anything. So that mock exam has made a reality check. So mock exams are equally important along with having a mentor, I think.
Mock exams. Okay, that's good to know, guys. Because as you know, if you take so many mock exams for the written component, those mock exams are equally helpful for the clinical component also. And I mean, it does cost money, but if that money is going for your own growth, then go ahead and spend it. So those kind of things, you should take mock exams. So again, congratulations to both of you.
Thank you, sir.
Thank you.
So good luck.
Ankit.
Stay in touch. Priya, let us know if you need any help, and stay in touch with us. Okay. So again, welcome to this amazing group.
Thank you,
Thank you,
sir.
Ankit.
All right, guys. You guys enjoy. I'll have other students.
Bye.
All right. Let me get Mona. And I'm not sure who is Vicky Shri.
How do I leave, Ankit? I'm trying to exit.
You can, I think you can just close from the top. Hi, Mona.
Hi. Hello,
How
sir.
are you, Mona?
Yeah, I'm good. Actually, I'm Aman. Mona is like a...
Sorry. I know your name. I don't know why I got distracted with that. Just give me a second. Let me see. We had some students. I'm not sure whose profile. Okay, just give me a second. Right. So Aman, first of all, congratulations. It's a big victory, big achievement. Imran, if you can send a request, I'll be able to get you. Somehow I'm not getting your request. I'm just reading the messages. Okay, great. So, all right. I guess he's trying, but I'm not getting it. So, Mona, big achievement. I mean, big relief. Done with the written comp and the clinical part. And Mona, you also, like, it's a long journey. Like back in the day when CAPR was conducting the clinical part, you'd prepared, but the exam never happened back in the day.
Correct.
So it became a very long journey. Thankfully, you were allowed to work, but like you prepared for the in-person exam, and then COVID happened.
Yeah.
You prepared for the online exam, but then they could not conduct the exam.
Correct.
I remember you took our mock exams also back in the day, whatever the new pattern was.
Correct.
And now you prepared for this. So it's like you're one of the smartest out there. You know, you can teach it. You can every format. So which is, again, the important part is what I'm trying to bring attention is like being consistent. Like doesn't matter. Like doesn't matter. You want to change the format, I'll study. So it's not easy. It's hard. But how do you manage, like, to be consistent and keep going with all the stress of like exams getting canceled, exam is not happening, taking a break from a job, losing money?
Yeah.
So what kept you going? Like, let's just keep going. What was that motivating factor? Hey, man.
Yeah. So I would try to be brief since I passed my written from again everybody in 2019, guys, and then COVID happened. It was hard to be taking your work off the track a little bit, maybe sometime, and then prepare for the exams again and again, and then again telling your employer that again I'm coming back full time. It was really hard, but I did had a good family support. I did had yoga on the to follow the updates from the college, from yoga. Finally, when I reached to OCE again, I decided to join.
Just give me a second. I don't know if the voice is breaking. Imran, if you can put your audio on mute. So let's see if that is going to make any difference. Okay. So yeah, I mean, go ahead. The family support and then employer. Just add the last one. That was very interesting point. I was just waiting.
Support and some motivation. You need to reboot yourself every day because studying, it was my second nature. If I do not study every day, it was like, what did I miss today? That is what my personal thing that happened to me because I was in long journey. But it's really important to think that I have 3 attempts and I'm going to utilize this attempt and I'm not gonna perform less than more than my 100%. You need to talk to yourself and prepare yourself to practice every day and dedicate your time in a day. Do not go off track like, okay, 1 week gap and then let's practice 20 stations and scenarios and then I'm good. No, be consistent. In a day you need to working full time and managing study at nights. Make it religiously. That's what I would say.
And you have a kid, right, Aman?
I have what, sir?
You have a son or daughter. You have a kid, right?
I have 2 boys. 2 boys.
Okay. And how old are they?
One is 8 and one is 6.5.
So how cooperative? Like I have a daughter, and it's pretty tough to study. So how cooperative are the kids? Usually, anybody who's listening, and definitely there are many people who have kids that age, younger than that. How did you manage with 2 boys? Like boys are like.
It's 24-hour storm in my house, and my husband is very supportive. And the thing is, I have scheduled their times: nap time, eating time, dinner time, lunch time, and I am very strict in terms of that. So you have to do.
That's very organized. Yeah, that's very great. That's great. So I'll go to Imran. Imran, you can turn on your mic. So Imran, congratulations. It's a big victory, Imran. I mean, big achievement. You should be proud of yourself. Imran is also one of our written component mentor. So he is, I mean, by default, he's pretty smart. He knows all the answers. So Imran, when I was teaching ethics, what I noticed in your answers was like you were very quiet and calm. Like not quiet, but like calmly explaining your point. I mean, everybody knows the answers, but what I was noticing in many other students was haphazardly trying to answer as many points as possible. You were giving 1 or 2 points, but that was clear. And that was satisfying for me. Okay, at least that those 2 points were very clear. So that was a very good strategy. If anybody is listening, don't try to answer too many points. If you can convince the examiner with few points, he'll be happy. He'll give you the point. He'll move on. Like we had Priya, she was able to finish her exam, and she had 30 minutes remaining. So apart from that, Imran, what was your strategy for part B, ethics section?
I just wrote it all the points, what I will share, and my first point was that don't say extra content.
Okay.
Okay, coming back to the answer.
Yeah.
So part B is like, see, what I have understood so far, that initially OC was mainly focusing on hands-on skills.
Mm-hmm.
However, OC is more focusing that we know if you don't understand the skill, if you don't know the skill, you will get it. We just want that we don't receive any complaint from the patient.
Okay.
That's what their main focus is for part B. So the best thing that I can approach in part B, that obviously I went through all the lectures that we discussed. However, I was reading the blogs from the college website. So it was for sure to me that before going to bed, I will read one blog from the college website as well as I will read case of the month from that website.
Okay.
Now, reading is not just enough, but selecting those particular words from the entire standard that they want to listen. If I just give a small example, let's say if I have to say anything that if you want to focus on infection control, right? Then as an Indian or as an just generalized, we usually say that I will just sanitize this thing. Sanitize is just a normal word. However,
How?
the main answer is clean and disinfectant.
Yeah.
Right?
Yeah.
So going through the standards and that particular word, I guess that's more thing that you have to focus for part B.
Okay. So you basically you meant that think about patient safety to make, and anytime patient safety is compromised, he may go ahead and complain or avoid complaints. They're not expecting you to be like the world's best therapist, but at least can you make sure that patient doesn't get angry or unhappy with your services?
Yeah. It's
Okay,
like if you say 1,000 patients, it's not about that. It's that for one particular patient that will ruin your life. So
yeah. So that's good. How about part A? Imran? Part A, because it's pretty huge, muscular neurocardio. What was the strategy for part A? Now, did you have any mentor?
Yeah, I did have Radhika as my mentor.
Okay.
Because I do understand that as I am also mentor for written exams, so it plays a quite important role to give a proper direction, right? Because it's very vast subject. The things you have to cover it within few months. And you have to ensure in the back of mind there is always clicking sound that you have PT resident title, it should transfer to registered PT. It should not go to PTA, right? So you have to ensure.
That's a scary moment. Okay, I know many people who are like very smart, but I have been getting calls from those students. So result is getting declared today or something. It will be released soon, and I'm scared. So, I mean, you're right that can cause fear in everybody's mind. Like we don't want to go back to PTA. That was a tough life, anyways. So yeah, go ahead, Imran.
Yeah. So my main strategy that I worked for part A was, so the blueprint has clearly mentioned what points they are going to ask, accepting the patient consent, assessment, discharge, and everything. So what I used to do is the case that I see for the entire day. So if I do one assessment today or two assessments today, based on the condition. So I used to read that particular condition at the night to ensure it gives me two things. One, it gives me that whatever treatment I'm doing, it superimposed that I'm going on a right track. However, it also gives me an idea that what questions could be asked, because patient also asks you some questions regarding the condition because they also search in the Google. So you get idea about that. And the second thing that I used to do is I just selected one point that if I have to focus on consent, then for entire week, all the new assessment, I will focus on taking proper consent. Second week, I will just focus on just this range of motion and manual muscle testing. Third week, I will just focus on like one particular point from the blueprint. You just select and you just focus on that.
Okay.
And I think it would boost because you are interacting with patients. So it gives a sense that they understood. It means the examiner will.
So were you like verbalizing how to take consent?
Yes.
Okay.
So it's like you know the steps, but how professionally you take the consent step during with the patient.
Yeah. That's the biggest part about clinical, because you guys know how to take consent. I mean, we have done that very extensively in the written component, but if a patient comes in front of you, are you able to talk? Are you able to explain? Or are you missing points? Even though you know all the points, but are you forgetting points like precautions, indications, points? So that's a good strategy. Everybody who's listening, practice, practice this each section of what he's mentioned. So I'll come to you, Aman. Aman, what do you think? Strategy for part A.
So I would say, as Imran mentioned, Blueprint has mentioned the conditions. I would write down common conditions of MSK cardio neuro. I would start one station every day.
Okay.
Since October students are going to go now, so I would practice all three categories, one station every day. I would verbalize, this is what I'm going to do, base, and pick and choose the condition, assessment, treatment, reassessment, any modifications. How would you deal with the patient? Put up some of these scenarios to situations of the patient, maybe financial constraints. Try to make questions. Those are the strategies. I would then have again everyday time and read the question when you appear for exam. Read the question very thoroughly. Take 6 minutes. It's okay. They are not in rush at that time. They give you time to read the question. Make your notes. Pick up the keywords. Is it post-op? Is it in a hospital? Or is it in an OPD? Or am I going for the community care? It's very important to keep those points into the mind and then speak.
Okay.
Yeah, that's what I would say in brief. Yeah.
Okay. So that's good. That's great strategy from both of you. Imran has had Radhika, and Aman, did you have any mentor?
I had Vrunda.
Okay. So and Imran said, so what's your feedback for mentorship? How helpful, preparing for the clinical by yourself versus having a mentor? How will you? It's not about rating a mentor, but rating that service of mentorship. How helpful is that for the clinical part?
Yes. So it's basically refining and repolishing. Mentor refines you, like whatever you have done, the rough work in your mind, that becomes fair, and then you perform in front of them. They give you feedback right away, one-on-one. And it's one-on-one. You get to know, okay, this is the part I need to work, for example, consent. Okay, this is the part I need to work on assessment of NMSK or cardio. And then practice those questions that they ask into the mentorship at home on your own later. And put up more questions to yourself that, okay, let me think this situation and make a question. And how would I answer to Vrunda next day?
Okay.
And that is what I would say for the classes, when our teachers send us, okay, these are the topics we're going to cover, prepare the topics and sit in the class, and you would be having an exam every day. Then on exam day, you won't feel like, okay, I'm having an exam today. So that's what.
Yeah. That's great strategy. I mean, that's good to hear about mentors. I mean, they're doing great. So again, congratulations to both of you. I'll let you guys go and enjoy your Wednesday evening. It's Friday night for you guys since you get the result. So go out and celebrate. Stay in touch, both of you. Those are some amazing strategies. Let us know if you guys need any help from us for anything. But good luck for the future.
Thank you. I just wanted to add one thing.
Yeah.
Just focus on one point, listening. Either it could be your patient, or it could be your examiner, or it could be your mentor. Don't think you know. Listen what they are saying and think to get sort out itself.
Yeah. Don't rush to just right away as soon as they finish, go ahead and answer. I think listening is one of the great strategy that I learn every day from my patients. Just listen to them and not haphazardly try to answer anything. What's the best answer? If any question comes, there are 3 or 4 answers. Which is the best one that will impress the examiner? And that will come with practice. Have your mentor ask you one question, think, and give him the most impressive answer. So that's great strategy. I think, Imran, you were one of the most patient in class, I remember. And those skills matter in the result. Those small things matter. So that's great. Good luck to both of you. Enjoy.
So
Aman, go ahead.
For part B, the vignettes that you have covered the domains. For example, okay, is collaboration should be there or not? Okay, I did that.
Okay.
Is management there? Once you practice 15, 20, 30, 60 times, when you reach at 100 vignette, you'll be like, okay, pro, I have covered all the domains in this. So you won't miss anything in there. And the good thing about Study Buddy is you call Mehul sir anytime, he'll be there. Okay, yes, what's the problem? Okay, this is what you need to do in it. Radhika ma'am, always helpful. Brunda ma'am, I have been in touch with these mentors since 2019. Unfortunately, I was not able to appear for the exam, but fun journey. It's been a very helpful journey. I would highly recommend Study Buddy because that's what has put me on this side today.
That's good. Very happy. Very happy. I mean, again, like what I heard, I don't know how true is that, but what I heard is the result for the OCE is not great for this batch, like not for Study Buddy, but overall number of students who took OCE, not many passed. Our result was very good, but because the reason I'm saying that is because a lot of people reached out that they failed. Many of them preparing by themselves or some classes here and there. So I started realizing, oh, our students were very good. They were prepared quite good because our result is so amazing. So again, it's hard work from both students, mentors, instructors, and again, cheers to everyone like who is involved. So cheers to both of you for working so hard, and thank you for sharing those amazing tips. That was very helpful. So I'll let you guys go enjoy, and then let me see if I have any other students. I'm not sure if I'm missing anybody. You guys can type in the chat box if I miss somebody. Komal is asking, do we have other batch for PCE from 4th August? Now, Komal, for written component, if you're asking, yes, we are starting from 4th of August. Clinical component, I guess our clinical team will be able to answer. So they will be able to, I think, around this almost the same time, I guess. Let me see if I have any other questions.
Yes, sir. While you are looking for it, I'll just share one last thing.
Sure.
And you can continue it. Yeah. So if any students are going for October OCE, you still have few months. The best thing that I did was I just spoke an assessment from top to bottom. Initially, I completed in 8 minutes. However, then I realized what matters is more patience and controlling your pace while speaking, because the other person should know what you are speaking, especially if they are born in here, then they wouldn't understand your language properly. Sometimes your pronunciations are not up to the point. So, and after a month, if you will practice, you will notice that now you are more able to elaborate. So, yeah, that's.
I think that's where Imran, mentorship makes a big difference. That because that allows you to practice that. But because if you're preparing by yourself, you keep reading. You're not practicing this dialogue delivery part. But with a mentor, I guess that thing gradually gets better. So I think that could be the reason why mentorship was so successful for the clinical. That's great. That's great. Okay, all right. Let me have. I think Vrunda is here. Vrunda is one of our instructor, and still not sure. Okay. In the meantime, if anybody has questions, please feel free to ask. And if our critical team, yes. Hi, Vrunda.
Hi.
And if we have Mehul and Radhika, if you guys can also join, let me have Radhika. And who else we have? So Vrunda, I mean, a lot of students were appreciating all your hard work. That was like an achievement. Hey Radhika.
Hi.
Okay, so I mean, like as you guys heard from students, that was mentorship was the game changer.
You can see the glow on our faces.
Yeah, mentorship made a big difference. That's everybody's feedback. What do you think? How, like we heard from student, but if we go with you guys, like Vrunda, if I come to you and ask you how mentorship is going to make a difference in their final outcome. What is unique about mentorship?
Yeah, according to me, every student is different. When you learn some content on the classes and then you practice and then you prepare, but you need somebody to tell you that you're okay. You need to work on more explanation, reasoning, or you need to work more on your sentence framing. where everybody has some different weakness and strength. So that how it helps.
Okay.
Plus, in a class, sometimes they are not, comfortable to ask some questions, or you're not able to reach them one-on-one. So we are available, like just a one phone call. They can call us anytime, and we can, evaluate them separately. So that makes a huge difference.
That's
Because
a good point, because our class is like, we have quite, I think I remember, more than 10, 15, 20 students in that live class who are attending it live. And yeah, anybody will hesitate to ask questions when like I'm asking questions back to back and kind of grilling them. But I think the point you mentioned is like they are reaching out to you individually and then be able to like speak up. So those things definitely makes a difference. And I think Imran was also saying that practicing the delivery part, which pretty much every student was under mentorship. So I cheers to both of you. And I think Mehul is not here. I mean, Mehul also played a good role. Okay, let me get Mehul also. He's also there. So Radhika, I'll come to you. Radhika, again, cheers. It was like amazing victory. Everybody passed. Hi, Mehul. So Radhika, Mehul, I'll come to you. Give me a second. Radhika, what's unique about the mentorship part in like when you're dealing with students? How could you manage to help them? Because few things you cannot catch in a regular class, but when they're talking to you individually, what did you find that they're lacking?
Yeah. So the difference between students who didn't take mentorship and who took mentorship, like for me, each student is going to be very, very important, regardless of whether or not they took mentorship or no. They can always reach out to me regardless of whether or not they took mentorship. So that is one thing. However, not everybody does that. So mentorship does allow students to kind of get more in touch with a mentor and have the chance to, without hesitation, and we have a one-on-one time where we kind of discuss cases a lot. And I think that is one of the most important things, to kind of throw questions at them one after the other and kind of surprise them with questions, or ask them put them in a tricky situation, like even teach them how to make a question out of a scenario, or how to make question out of each topic. So things like that we kind of discuss a lot. Other than that, I mean, each student, as Brenda said, is very different. And after analyzing them, like, it doesn't take more than 5 minutes for me to understand where the student is lacking. So after understanding that, I try and throw things at them as needed. So some people are good at ethics, some people just need some finishing in knowledge in ethics, and they don't need much in ethics. However, some, they haven't had that kind of work experience. So then you need to give them more of ethics, and you could kind of, maybe they're good in their part A already. So depending on what unique situation that they're in, or what kind of workplace they are working, and what kind of experience they have working in Canada, I think those things work out well in mentorship, because you get that time with the students to spend.
Now, one more question to you, Radhika.
Yeah.
Now, and one more thing. I think Brunda and Mehul, if you guys can mute your mic, I guess that might be breaking the voice. Might help. So, Radhika, like, what did you notice in these students who were taking your mentorship? Was there anybody lacking knowledge, or was it precisely the delivery of answer? What was the problem?
So there were unique problems, but I would say lack of knowledge was not the biggest problem, I would say. It comes on with reading. So if you're sincere enough to read the topics well, like even once, I think the knowledge should not be a problem. It's about understanding the question and understanding what the examiner wants to ask you from the question. That is a skill that not everybody has, and that can be kind of explained to them, that okay, well, you need to focus on these things and understand what the examiner is wanting to ask you, understand the hints that the examiner is giving you. If they're not liking your answer, if they're redirecting you, like, how will you understand that, right? So I think those things. And apart from that, some people don't lack direction, so they get lost after a point. Like, how much do you study? Like, you just keep on studying. So then you need to redirect them,
Yeah.
like, okay, like this is going nowhere. You need to kind of make sure that you have a plan, because having a plan is one of the most important things that you need to pass the exam. Like if
I think
you are directionless doing a thing without even thinking, then that's not going to help you.
I think that's where mentorship makes a difference. So, I mean, that was great, all the suggestions. So, hey, Mehul, congratulations. I mean, a lot of students made it. It's a big victory to the whole clinical team.
Exactly.
So, Mehul, what do you think? What are we doing? Why should a student join OCE classes?
First of all, to pass the OCE, right?
Yeah, but
Exactly. So,
how we can make a difference?
yeah, so each and every time when we teach in a new batch, we learn few things from the students as well.
Yeah.
Different things when the students sometimes ask those questions, and we are like, wow. And while answering those questions, we get to learn about new things, right? And you realize that, okay, you answer something differently, and that can be used in your exam to impress your examiner. So while you are teaching, you are learning new things, and you are using those strategies to help your students in a different way. So yeah, definitely, when we take the classes, each classes we are doing case studies.
Yeah.
Students are performing, so we start learning about the students. Usually students who are going in a recent exam, they usually come up with the answer, and also we know that they are going in exam and they are preparing, and we know from the class starting that, okay, where they are lacking, what kind of mistake they are making. And if they have taken mock exam or mentorship, we'll come to know more in details about, okay, where we have to focus them. And throughout the class also, they also reach out to us, and we always guide them. And by the class is done, like they get to learn a lot case study. We have 14 lectures. Each lectures we have different case studies. So 50-60 case study they learn in details plus notes. So a lot of things they can learn throughout this course.
And one thing I noticed was when I teach ethics part in clinical OCE. So what I noticed is, let's say I'm asking, because we are practicing stations in every class, right? Just like part A, for part B ethics also, we are practicing stations. Now, a student, like let's say I'm asking one student to respond to that question. The rest of the students are listening, and they are also evaluating what to answer and what not should I won't be answering like that, what mistake to fix, or that answer was very impressive. So I think I did get that feedback from many students, that when they hear from somebody else, and they realize, oh, I never thought like that. That was a unique way of answering. Let me note down these points. So that's one of the most important part of the of our life class, that listening from other people, from peers also, like what can be a better response or what can be a terrible response, what I should not answer in the main exam. So that, I think that can be one good strategy for anybody who's listening. That's what you get from the live class. Also, I mean, we do provide recordings, we do provide notes. I forgot to ask you other students about the notes, if they were able to use extensively. But I think I got feedback from students directly that our notes are quite extensive. Definitely, there's always a scope of improvement, but I guess we are on a right track. So anybody who is going for exam, OCE in October or January or next year, March, do you guys have any questions? Like why to join Study Buddy, or why, when to start preparation? I mean, if you guys can put your numbers in the chat, they can reach out to you guys and discuss those things in more detail. So guys, these are three our main clinical instructor. They teach part A, I teach part B, but your best bet will be to reach out to them, Runda, Mehul, Radhika, to discuss what they, and they are our mentors also. So our instructors are the mentors too, so they can answer your questions. What you're going to get in mentorship, what is the fee for class, those kind of things. Right now, we are taking non-study buddy students also, but probably not for long in future, because we try to keep the mentorship class size very small. So you can reach out to our mentors for any questions. Who's Mona? Is that our student or? Okay, so I think
I
Mona.
think she understands that
Yeah, okay.
if you want to
So you guys
have
can
it,
reach out to Mona. That's okay.
so we can reach out to Mona then.
So I think that's it. Anything else? Did I miss to add anything?
No, I
Not,
guess
Oh, hi,
I
Mona.
think to ask the most direct questions and the most important questions that everybody would actually want to hear as students who are even sitting outside of the country. They're so anxious because they don't work. So I think you've asked so many other questions that are so helpful. Thank you.
Yeah,
I think few students asked that if the students were working till the
full time.
exam.
Mm-hmm.
About the students who took my mentorship, most of the time they were asking that should we take off 1 month, 2 months, and I was like, it's like a strategy to work and get money and the practice. So why you want to waste that time? Just go treat your patient and learn new things every day and start practicing. And if you still stress out and you want to relax, just take 1 week or maximum 2 weeks off before your exam, but you don't need more than that in online exam. If it's in person or something that you need some more detailed practice, for that is a different story. But for the OCE, I don't think so. You
And
need
for
more than
OC,
2 weeks.
working actually helps you in the exam because
Yeah.
you're interacting with the patient. So I tell all the students that, hey, go and work, build up that experience of how to communicate with somebody. Because coming from international countries like India or other countries, um, we don't communicate in English. Our primary language is not English. Now you have to suddenly communicate with an examiner, Caucasian, and now you have to communicate in English and respond. Or I think, because some of the strategies, if you guys heard, Imran had or other students had in the beginning, like Pavitra and all, the strategies were very unique. Like they were using clinical cases from their work and practicing it. Like, how do I take consent? How do I do this and that? Those are pretty interesting for me, actually. So I think that's it for. I think we're already more than an hour. I'll let you guys go and enjoy. Thank you again, everyone, for attending, for coming for this live. I think it was very successful. We had more than 100 students at one point. But again, if you are planning to go for the exam, reach out to our instructors. They can be very helpful. And let us know if you have any questions. Okay.
Thank you
Bye.
guys for
Thank you.
joining us today.
Thank you. Bye.